All right, so Dr. Vaughn, let's start here. I know you have the hearing on in the background. I just heard it. I also saw that IMA is running a campaign to support RFK Jr.'s nomination. Tell me a little bit about what you want to see and why you are backing him.
So for me, what the last 4 to 5 years kind of revealed is our medical, what I would call medical industrial complex, is less than honest and less than functional. And so in many ways, what I like about RFK is the fact that his integrity to go back to what science is based on, which is data, and look at that data and finding better ways to solve things and actually really be more honest with people about what we know and what we don't know. And that can have anything to do from what kind of things are in our food, to what medicines should be approved or available, to what kind of vaccines might need to be approved or required for our children.
Do you feel like I guess the people like to throw this around, he's going to shake things up. Do you think that's an accurate way to describe what he wants to do?
Yeah, I definitely think that. I mean, he, out of anybody, and even in the hearing today, was kind of funny, actually. I think Elizabeth Warren was asking him not to take money from drug companies. I don't think drug companies would give him any money because that's not what he's interested in. He's not interested in any downstream things. First of all, he's a Kennedy, somewhat, probably is financially okay. What he really cares about is trying to solve the problems that are causing America not be competitive as a nation. And, he, again, stats that are kind of crazy. We're 4% of the population and we take 55% of the drugs that are actually produced in the world. The fact that 6 out of 10 Americans have a chronic condition. The fact that 74% of all people in America are considered overweight. Those are problems. Those are problems for our overall global, what I would say, thankfully, dominance, but America first type principles that in terms of how we compete globally, not only on the battlefield, but in terms of just how we are as a nation, in terms of our productivity and our ability to continue to evolve and prosper.
And if you can just expand a little bit, I mean, you mentioned some of the, disease. You mentioned, I don't know if you mentioned this, but obviously food, big part about
Yes.
what he wants to take on. I mean, how do you, I guess, what can he do? What is the?
So just you can take something as simple as the way the NIH works. The way the NIH works is basically on a very siloed system that divides everything up into system areas. The system areas don't talk very well. But in reality, what's really going on in a lot of disease processes isn't these simple problems that should be divided into a specialist, but instead it affects the whole system itself. And then the other thing is we need to start investigating causes rather than treatments. So again, I'm not against treatments, but a lot of times, as Marty McCary, the coming FDA head, would say as a pancreatic surgeon, he's seeing doubling of pancreatic cancer, but no one seems to be interested in what causes the doubling. Instead, we're just developing ways to treat it. How about we prevent it? The actual expectancy of life after a diagnosis of pancreatic cancer is dismal. How about let's not get it?
And, finally, obviously I think from a political standpoint, you have a lifelong Democrat now joining a Republican administration. Some of his past things have been brought up at the hearing. Do you think that matters to people? Do you think there are Republicans out there who will reject him because he has Democratic liberal views on some things, or are you satisfied with how he's answered questions about abortion and things like that today?
Yeah, I think he's done a pretty good job of it. I think in terms of what I would consider him as a classical liberal, the word, classical liberal means everyone brings their ideas and we're allowed to actually discuss them. And it's actually a lot how science works, which is who brings the best data. And sometimes we always question the data. In a sense, sometimes we need to reevaluate things all the time. And Robert Kennedy's somebody who's kind of stayed that way throughout the back and forth fray. He's always been who he is today.
And I know I said last question, but this one is the last question.
Okay.
As far as like, I guess if somebody were to say, well, he's not a doctor, what does he know about the health? What can he actually do?
Well, the current head of HHS is the former Attorney General of the state of California. The previous one, Sebelius, I mean, literally, if you go down the HHS administrators, you count how many doctors there are, or anybody with any medical training.
And so, and I guess to your point, you don't need to be a doctor in order to run this department effectively. And maybe in this case, we need an outsider to sort of to get things going.
Yeah, 100%. We need somebody who understands the ills without that isn't part of the system itself. And again, I mean, even my friend Dr. Robert Redfield, who was former head of the CDC, is writing a letter in support of him as well. So therefore, the former head of the CDC is in favor of him. He has made a lot of believers out of a diverse group of people, if that makes sense. And I think that's what's important. Leaders that have the trust of multiple different perspectives are people that are going to make true change.
Well, thank you so much. If anything I missed, anything you want to add?
No, I think I do think it's interesting. I mean, tomorrow will be interesting too. But the finance committee is asking a lot of health questions. I thought they were the finance committee, not the health committee.
Yeah,
I mean,
tomorrow's the health.
it seems like the finance committee should be talking about how screwed we are in terms of long-term liabilities and Medicare costs, but no one seemed to have brought that up. But anyway, so